Hello. Can someone please reply if I'm audible?
Yes,
Yes,
ma'am.
ma'am.
Okay. Okay, so Dr. Zubin sir has also joined already, and I guess it's already 5, so we will start. The remaining students can join as and they can do. Sir, am I audible to you?
Yeah, you're audible. Yeah.
Okay, sir. So I first of all welcome you on behalf of everyone, like the entire team of medicine and the doctors who are here. So today's topic, I think it's very important from everyone's point of view, because we've been seeing a lot of fever cases these days in the OPDs, and I'm sure everyone must be very excited to learn so many new things today. So Dr. Zubin sir is practicing now, I guess, more than a decade, and he's known for his prescriptions and his specialty in treating fever cases purely with homeopathy. So I think it's going to be very much helpful to every doctor who is attending this session. So I request everyone to be very interactive and pay full attention and have the benefits of this lecture. Sir, can we start?
Yeah, sure. Thank you,
Yes.
Dr. Vaidai, for a nice introduction. So I will be sharing in this lecture my experience around 10 to 12 years, how I approach the cases of fever with homeopathy, and how do I take up the follow-up and how do I investigate further. Purely with homeopathy is difficult nowadays because many a times patients come to me after they have not better with the allopathic treatment. So it's very difficult to say that I get a pure fever case initially. Hardly 10% of my cases would be first time, I'll be honest with you. But a lot of failures from allopathic treatment, not responding to fever by allopathy, are coming to me for sure. And mainly the pediatric cases respond wonderfully with homeopathy, and results come with homeopathy in a matter of few hours, even though the fever may be for 10 days or 15 days. So with this short introduction, I think let's begin. Can I start, Vaidehi? So first I'll be discussing the pathophysiology controlled by the hypothalamus, where the body regulatory mechanism is located in the brain. So normal range of temperature in our body is between 97.7 and 99.5 degree Fahrenheit. So any temperature above 99.9 or 100 degrees is defined as fever. This is very important because many times patients tell that they have temperature of 99 or 98.8 or 9, and they declare themselves to be having fever. And also you should remember there are many variations in the diurnal and seasonal variations in the body temperature. So fever can be very low during the morning times and in summers, and very high around afternoon 4 p.m. and during winters. Rectal temperatures are usually higher than the oral temperature, about 0.7 degree Fahrenheit higher than the oral readings. In women, there are temperature variations related to their menstrual cycles. So before ovulation, the temperatures are on the lower side, morning temperatures, and it rises by 1 degree Fahrenheit with ovulation and afterwards. So this could help us to know the physiological variations in the temperature. So we have to differentiate fever with hypothermia as well. So in hypothermia, the temperature goes above 106.7 degree Fahrenheit. That is very high grade fever. And these fevers, they usually don't respond to any antipyretics, Docin or ibuprofen. Yeah, they don't respond to antipyretics in hypothermia. And the heat losing mechanism fails when the patient is suffering from hyperpyrexia. So in this, somebody is on, I think so. Hello.
Dr. Preeti, your mic is on. Can you just put off your mic? Yeah, thank you. Yes, sir, you can continue.
Yeah, sure. So in hypothermia, when the patient is having such a high degree temperature, you should look out for stroke. Basically, the intracerebral hemorrhages, they present with hypothermia. So to identify such patients and they need immediate hospitalization. I'll suggest not to treat them in OPD basis, better to get them hospitalized. So hypothermia and fever needs to be differentiated in our clinical practice. Okay, so what is the pathogenesis of fever? So fever starts maybe due to infection or inflammation, which leads to leukocytosis, mainly neutrophilia when there is a bacterial infection. So this infection and inflammation can lead to elevation of our cytokines, mainly IL-1, 6, and TNF, which leads to elevation of prostaglandin E2 in the hypothalamus area, and it raises the hypothalamus temperature control set point, which leads to increase in the body temperature and fever. So in hyperpyrexia, the interleukins are released in the brain itself, mainly due to hemorrhage in the brain or due to trauma or infection of the brain itself. That's why we see such a high grade rise in temperature in hyperpyrexia, as cytokines are released directly in the brain itself. So let's go for the approach to patients with fever. So we have to ask these basic questions when we see a patient with fever or when we hear a telephonic conversation from a patient asking for help with fever. So first question is how to begin, whether we need to investigate this fever, how to begin our first prescription, what precautions and vitals should patient observe in himself when they are in our treatment of homeopathy, and when do we call patients for follow-up, and how to ascertain that the fever will not recur. Means after the first prescription, the fever subsides, and how to make sure the fever doesn't reappear, and how you can be clinically sure that the fever is being treated completely. So this is how I approach the patients with fever. So first, let's begin with the history and physical examination. This is from clinical point of view I'm talking right now. So first we need to inquire what are the events which were before the fever, like exposure to some cold or someone having any fever, or exposure to getting wet in rains, mainly the ailments from or some vectors or some mosquito bites or anything like that. So when the patient is having fever, it could be from any one of these causes, mainly the infectious disease, or it could be autoimmune and non-inflammatory disorder. It could be related to the cancer. It could be related to certain medications like vaccines, which are very common nowadays, mainly in pediatric cases. The fever may be due to certain drugs or antibiotics, hypersensitivity to certain drugs, cephalosporins, anti-tubercular drugs, quinines, methyl dopa, phenytoin, aptoin. So whenever there is a drug fever, the patient will present the symptoms resembling the allergic reaction. There could be some rash, swelling, urticaria, joint pains along with the fever in such patients. Certain endocrine disorders like hyperthyroidism can also present with fever. Or lastly, it could be due to hypothalamic malfunction, like we see in patients with strokes, hemorrhage in the brain. So when we examine the patient, important is to examine the pulse as well. So whenever there is a temperature and pulse dissociation, that is when the pulse is on the lower side in spite of the high grade fever, the question should be asked about infections like typhoid fever, whether it is a brucellosis, leptospirosis, or some drug-induced fever. Or even it can be a factitious fever, that is a psychiatric disorder called Munchausen syndrome, where the patient deliberately feigns to be having a fever. So whenever there is a bradycardia along with the high temperature, either it could be due to typhoid fever or some infectious disease, or it could be some psychiatric illness also should be ruled out. So infections with fever, the patients can have the pattern of fever can be determined, what time the fever appears, whether it is a continuous fever, intermittent fever, or whether it is a remittent fever, it should be determined while taking the history. So whenever there is an intermittent fever, that is fever followed by the period of apyrexia for longer duration or a day or two, think of malaria as a infection. So in Vivax, the fever appears every third day, and in Plasmodium malariae, it appears every fourth day. Certain infections which are uncommon in India, like Lyme disease or ticks, can also have several days of apyrexia and then followed by the fever. Another important condition when there is a apyrexia of long duration followed by fever is seen in malignancies, mainly the lymphomas, Hodgkin's and non-Hodgkin's lymphoma. This pattern of fever is called Pell-Epstein pattern of fever. So what are the effects of fever? So what are the physiological changes you will see when the patient is suffering from fever? So when the fever or the body temperature rises, the oxygen demand of the body also increases. So for every 1 degree rise in temperature, there is around 13% increase in oxygen consumption of the body. So why this is important is because when you treat a patient who is elderly and having underlying conditions like that of cardiac COPD or pulmonary hypertension or some CNS dysfunction, their oxygen demand is already elevated, and these patients are more there are more chances of getting hypoxia in such patients when they are having a fever. Also important when the children with history of convulsions, whether they are febrile or afebrile, is having a fever. So such children should be treated very aggressively and make sure that the temperature does not rises above 100 degree Fahrenheit, because this itself can bring about convulsions in such children. So when you see the blunt response of fever, so even though the patient is having infection or inflammation, the fever is not very high grade. So when you see such cases, the patients who are on long-term steroids, mainly corticosteroids, or patients having some chronic disorders of kidney and liver function, where the immune systems are on the weaker side. Other conditions are like autoimmune disorders like rheumatoid arthritis and all, where the patients are already on disease modifying agents called anti-cytokine therapy, where the fever response is not seen much in such patients. Also, patients having septic shock can present with severe hypothermia due to peripheral vasoconstriction in patients with septic shock. Am I going very fast, or this speed is okay?
No, sir, it's okay.
It's fine, no?
Yes, yes.
Thank you. Yeah. So what laboratory tests we need to advise when the patient is suffering from fever? So first important is to do a basic CBC differential count. So in differential count, we'll we know what kind of counts are elevated, whether it is neutrophil, lymphocytes, or monocytes. So whenever there is a neutrophilia, think of bacterial infections with high counts. Whenever there is a neutropenia, mainly seen are viral infections nowadays in COVID patients and influenza also, there is a neutropenia seen along with the fever. So measurement of cytokines is not very helpful according to me in the clinical practice, as it does not really correspond to the severity of the fever. So nowadays, it had become earlier in the pandemic very a common trend to do a cytokines level, which are very expensive and they really don't help much because clinically the patient might be okay, but still the cytokines would be very high. So this is more of a physiological thing according to me and not very helpful for the clinical diagnosis or the prognosis of patients with fever. More important are to do a CRP and ESR levels. So they help in to know the prognosis of fever, whether your treatment is responding or not. So when the CRP levels are raising, means your treatment is not responding. So you need to change the remedy in that cases. But when your CRPs are reducing, that is inflammatory biomarkers are reducing, you are in the right direction and your medicine is working. Second, after determining these parameters of fever in lab tests, we need to know the focus of infection. That all depends on the symptoms presented by the patient. So if there are urinary symptoms, you would advise a urine routine at first. Then if there are more of a viral symptoms you see, you need to confirm such cases. You can advise a PCR or RT-PCR test for that corresponding viral infection. So when the counts are very high along with the respiratory symptoms, counts more than 20,000, better to advise an X-ray, chest X-ray to know if there is any pneumonia or pneumonitis in such patients. Other thing on lab investigations, fever with thrombocytopenia, lower platelet counts. So platelets less than 1 lakh or 80,000. What are the causes of such low platelets in patients with fever? So main causes are dengue, malaria, chikungunya. It is also seen enteric fever, typhoid, and sepsis. Severe bacterial infection can also present with thrombocytopenia. To determine what is the cause, mainly we do a dengue NS1 antigen or RT-PCR for dengue and IgM, malarial antigen, peripheral smear for malaria, blood culture in cases of enteric fever, and chikungunya antibodies and lepto antibodies as the case may be. So what is the conventional or the allopathic line of treatment for fever? Initially, they would advise us to drink plenty of water, patients, so that they don't get dehydrated. Advise them to take appropriate rest, keep the body temperature on the cooler side. They give antipyretics to reduce the hypothalamic set points and to facilitate heat loss. Acetaminophen, that is antipyretic. NSAIDs and aspirin are not given by them because it reduces the platelet levels and causes a lot of GI symptoms. Aspirin is forbidden in children because it causes Ray's syndrome, which is bad, which is. So let's start with the homeopathic management of fever. So how do we approach the patient from homeopathic point of view? Patients having fever. So examination of patients from homeopathic point of view. So when the patient comes from homeopathic point of view, you need to individualize the patient, form the totality of symptoms of the patient. Once this is done, the most difficult part has been accomplished, according to Dr. Hahnemann. So individualizing that characteristic symptoms of the patient is most important. So what qualities the physician or the doctor requires in homeopathic case taking? He should have great knowledge of human nature. He should know the history of diseases. He should have a perfect knowledge of materia medica. Also, while taking the history, he should note all the symptoms before and during the paroxysms of chill, heat, and sweat. And most important, the symptoms in apyrexia, that are symptoms of the patient when there are no fever. Also important is the time of paroxysm of fever, which part of the body the paroxysm appears, whether it is a chill, heat, or sweat, whether it appears first on the head, on the neck, on the chest, or the back, or on the extremities, where the heat is more, that is more important while taking the history and clinical examination. Whether the stages are regular or irregular. So whether the fever is happening at the particular time of the day or there is no such thing. It can happen any time of the day is also important. Whether there is a thirst, whether it is absent, and if present, what is the degree or intensity of the thirst? What are the timing of taking water or thirst of the patient? Whether it is before chill, during chill, before heat, before sweat, all this is important while taking the homeopathic case. Also important are the constitutional symptoms during the fever. Whether the patient is having weakness, tiredness, whether he is drowsy, whether he is alert, whether he is angry during fever, whether it is physically having joint pains or diarrhea, all these are important to notice in while taking the history of patients in fever from homeopathic point of view. So from point of view of when to administer the remedy, Dr. Hahnemann has given clear guidelines in the Aphorism 236 to 238. So he says that the medicine or the homeopathic SIMILIMUM should be given at the termination of the paroxysm. It should not be given during the paroxysm or when the fever is very high. So if you give in the when the fever is high, it will lead to undue aggravation of the symptoms and it could be dangerous for the patient. So better to give the medicine in the stage of apyrexia or when there are no paroxysms of fever, then only the homeopathic medicine will work well. In Aphorism 237, he says, if the paroxysm is such when there is no time to give the medicine, so we should give the medicine towards the termination of the paroxysm. Suppose the patient is having a continuous fever or remittent fever, so towards the decline of the paroxysm, the medicine can be administered. So when there is no time to administer the remedy, better to give towards the termination of the paroxysm of fever. Then he gives guidelines on the repetition of the remedy. So when you need to repeat the SIMILIMUM in fever. So if there is a continuous amelioration, the medicine should not be repeated. And it can be repeated if the same paroxysm appears, then only the medicine should be repeated. So after the first dose, you might get an aggravation. That is, the fever might become elevated, but patient in general would be feeling better. That is, thirst would improve, the sleep will improve, he will be a better control. So in general, he'll be more energetic. That time you need not repeat the medicine. So this is followed by the amelioration of the symptom. So you should wait after giving the remedy. If the fever rises and the patient in general is better, do not repeat the medicine. But if in general the patient is not better, then you can repeat the same remedy if the totality of the symptom is same. Otherwise, you need to re-evaluate the totality of symptoms and give the next similar remedy. So when we need not repeat the medicine. So continuous progress, as I told, needs no repetition of the remedy. So whenever there is a continuous amelioration, you should not repeat the remedy. Then Hahnemann has told about SIMILIMUM and the potency selection. So selection of remedy is very important. Followed by the remedy, we need to decide what potency to be given. So according to him, the potency, rather these guidelines are given in Dr. Allen's Therapeutics of Intermittent Fever, where he says the potency in question is insignificant. The more perfect the SIMILIMUM, the quicker and surer the cure. If the remedy is correct, irrespective of the potency selected, it will definitely work. But if the remedy is not proper one, and if you keep on repeating the remedy, whether it is in high potency or low potency, you will utterly fail, or you will suppress the attack. So it is the quality, not the quantity, that cures. So proper selection of the remedy is more important than the quantity, that is the potency, selection, and the repetition. So in cure of intermittent fever, Dr. Allen has said, you need to study the patient during apyrexia, that is when there is no fever, in order to form an exact idea of the functional action, regular or otherwise, of all the organs. So we need to analyze the symptoms of the patient during apyrexia, when there is no fever. Observe all the symptoms of the fever itself, that is 3 stages of the fever: cold, heat, and sweat, as well as shivering. Also note if any stage is absent. Suppose the patient is presenting only with the heat and sweat and no chill, and heat and chill and no sweat, that is also important. The absence of paroxysm is also of utmost importance. And more bizarre, singular, that is symptoms in a case are of utmost importance in selection of the remedy. So those symptoms which we cannot explain on the basis of the pathophysiology are more important in selection of the remedy. So in cases of masked intermittent fever. So what are masked intermittent fever? Are those fever where you do not get the usual chill, heat, and sweat stages. So these are the cases which I see in most of my practice, where you don't get the exact paroxysms of chill, heat, and sweat. So they are all masked because they have already been treated with antipyretics, antibiotics. They have already been suppressed. So in such cases, what is our guide in selection of the remedy? So our only guide in such cases is the constitutional symptoms, that are general symptoms of the patient. It could be a mental general or the physical general of the patient. So our prescription should not be based on the local symptoms of the organs and tissue, but more on the general constitutional symptoms in order to bring about cure in cases of fever, as told by Dunham. So whatever may be the name of disease, whether it is a typhoid fever or viral fever or malarial fever, if the generals of the remedy correspond to the case, we should not hesitate to give that remedy. Suppose you find the generals of arsenic, then you should not hesitate to give arsenic. If you find the generals of chelidonium, you should not hesitate to give chelidonium in cases of fever. If you find the generals of veratrum, in a case, you should not hesitate to give veratrum in cases of fever. So general constitutional symptoms of the remedy are more important in such cases where the exact paroxysms of fever we cannot determine in our practice. So let's start with the utility of our repertory for fever cases. So most important work for treating fever cases has been done by Dr. Boninghosen, mainly Boninghosen, who has given in the therapeutic pocket book, and has been further revised and reevaluated by Dr. Boger in the repertory of BBCR. So let's discuss first the concept of BBCR repertory. So BBCR repertory is based on the doctrine of complete symptoms and the concomitants. So this is very important in such cases because nowadays we get a lot of incomplete symptoms. So when you use this repertory, you are not at loss because even the incomplete symptoms are there in this repertory and it will help you in the selection of the remedy. So then it's based on doctrine on the pathological general. So a lot of pathologies are being kept in this repertory. Doctrine of causation and time. At particular time the fever happens, paroxysm the fever happens, the aggravation and amelioration are all there in this repertory. A lot of clinical rubrics are there in this repertory, like typhoid fever, malarial fever, measles, or fever due to dentition, worms are all discussed in this repertory. Evaluation of remedies. So you get the exact evaluation of the remedies, grading of each remedy from 5 marks to 1 marks. So more the grading, the better you are. The remedy are similar, and it will help in a better selection of the SIMILIMUM. Then there is a separate fever totality given in this repertory. So all chapters of chill, heat, sweat are given in detail in this repertory. And lastly, the concordances, that is the relationship of the remedy. If you want to know which is the next best remedy to be given, whether they are inimical or whether it follows well or not, all can be determined in the concordances of BBCR repertory. We'll go to the arrangement of BBCR repertory of fever. So in particular chapters, like in chapter of head, chest, there could be rubrics under aggravation for before, during, and after fever. For example, nose bleeding after aggravation fever, hiccup aggravation after fever, yawning with fever. There could be types of fever given under particular chapter, like hay fever given in chapter of coryza. In skin and exterior body, scarlet fever is given with eruption. Sensation and complaints in general, in infants, dentition, affections with fever, all these are given scattered in different chapters in BBCR repertory. The different pathological types of fever are mentioned in the chapter of fever, like dentition fever, hectic fever, infectious, inflammatory, intermittent, measles, septic, typhoid, worm, yellow fever. The chapter of chill. So in chill chapter, each chapter is having a time modality followed by aggravation, amelioration, and concomitants. All are important. Then in chill chapter, it's given cold, coldness, whether it is a partial chill, partial coldness, shivering, and partial shivering. This is the arrangement of the chill chapter. In heat and sensation chapter, heat in general, whether it is a partial heat, it belongs to certain parts of the body like head, feet, face, tongue, epigastrium, abdomen, chest. Time of aggravation is again mentioned. Then ameliorating aggravation in general and amelioration in general of fever. Then concomitants of fever, like mental symptoms with fever, head symptoms with fever, eye symptoms or throat, thirst, nausea, vomiting happening with the heat stage of the fever is mentioned. Sweat stage again, time modality, aggravating, ameliorating modality, lot of concomitants of sweat, whether it is a partial sweat to certain parts of the body, as well as the characteristics of the sweat, whether it is profuse, scanty, staining, offensive, all given in the sweat chapter of BBCR. There's a chapter of compound fevers in BBCR. In this, there's various permutations and combinations of paroxysms of fever are given in particular order, like chill, then heat, then sweat, or chill, then sweat, then heat, with thirst, without thirst. All these permutations and combinations are given in compound fever. So main rubrics beginning with chill, or beginning with heat, beginning with sweat, or beginning with shivering. So chill followed by heat or sweat or shivering, whatever the case may be, you can look in the chapter of compound fever of BBCR. There's a chapter of aggravation and amelioration in general. In this chapter, we can know the general aggravation and amelioration, whether it is related to fever or during apyrexia stage. Okay. There is one separate rubric for scarlet fever after aggravation in this chapter of conditions of aggravation and amelioration. So now I'll be sharing 2 cases of fever, how I had approached, how I have repertorized those cases, analyzed those cases, and materia medica part of it, and what is the potency selection, how I approached, and how it was treated, cured. So let's start with that. So first case I would like to share is a case of a 5-year-old girl who came to me on 30th of November 2017 with complaints of fever. Fever was with rash mainly on the back. The child was already on pediatrician's care and allopathic treatment, but without relief. Red rash was all over the body now with fever. There was coryza before fever. Chills usually accompany the fever, and the fever is more during the sleep. Thirst was good, generalized body ache with fever, and there was difficulty in walking. The generalized pain the child was stating was worst on first rising from the sleep or first beginning to move from sleep. So these were the symptoms given by the parents and the child. So on examination, I found there are a lot of maculopapular red rash all over, mainly on the trunk and extremities. The TPR was normal. On examination, chest was clear. Abdominal examination, no abnormality detected. CNS, child was well oriented, responding to all questions. SpO2 was around 98%. What investigations were done by the parents? On 18 November, the CBC was done, count of around 8,500, but neutrophilia of around 90%. Dengue was negative. And on 28th of November, that is after 10 days, the chest X-ray was done, which showed left zone pneumonitis. That was the case. The child had come to me on 30th of November. Before that, the X-ray was done, which showed pneumonitis. That's when the child had came to me. And child had already been given antibiotics, but did not respond. The fever never came down. So the pediatrician had advised blood culture, but before that, they had come to me. So from this, I analyzed the case and I took some few symptoms, what I found out. So I took eruptive fever of measles because eruptions were like that of measles. Eruptions, fever during eruptions, rash, fever with chills, thirst with fever, pain during fever, fever during sleep, and I took pneumonia, beginning of pneumonia. So I repertorized these few symptoms. They are very vague symptoms if you have a look. Using 2 repertories, mainly the synthesis and the BBCR repertory. So first I repertorized using synthesis repertory, which is based on Kant's philosophy, Kant's repertory. So I took eruptive fever, measles, rubrics, fever which comes during sleep, that is heat stage comes on sleep, pain during fever, eruptions with fever, eruptions rash, fever with chills, and inflammation of the lung, left lower lobe. So, okay. So only characteristic symptom I found was eruptive fever and the fever which comes on during the sleep. And other general pains were there with the fever were also there. Then I repertorized using BBCR repertory. These were the rubrics taken. I took pneumonia. Then I took measles in pathological type of fever. In chill, chapter I took chill in general predominant. Fever chapter, aggravation of pain symptoms with fever, aggravation of fever in sleep, concomitance of thirst with fever, and concomitance of skin eruption, that is rash with fever. So in both this repertorization, I found Rostock's coming up first. So then I looked up in the Materia Medica of Rostock's. So indications of Rostock's for fever. So in Rostock's, there are a lot of pains in muscles and tendons as if they are torn, and bone pains as well, which are worst after midnight and in wet weather. Aggravations are in wet, cold weather, and at night time, mainly the midnight. And aggravation is from the rest. Ameliorating symptoms are from warm, dry weather, wrapping up, or from hot things. And amelioration in pains are from continued motion. But in Rostock's, there is an important characteristic that the pain symptoms are first aggravated on movement, but when he's continuously moving, he feels better. So pains are mainly due to the stiffness of the joints and muscles. So once the patient starts moving in Rostock's, he finds relief from continuous motion. So amelioration from continuous motion. So continuous motion relieves the stiffness and the pains gradually decline. Okay. So time modality of fever in Rostock's is it can happen in any time except the forenoon, and heat stage is with the fever. So in our case, also the pain symptoms were worse on first getting up from the sleep and better by continued motion. Also for the eruptive fever, Rostock's is an excellent remedy. And in repertorization as well, as we can see, Rostock's was coming up well. So I prescribed Rostock's 30 to be given every 8 hourly. I gave 8 hourly because already the susceptibility of the child was on the lower side, as the child was already on the antibiotics. So we cannot repeat that frequently. And I asked the parents to report after 2 days after, and after improvement of the fever symptoms and general symptoms to stop the remedy. But the patient reported to me after 10 days on 11th of December 2017. So according to the parents, the acute episode of fever and rash had gradually subsided after 3 doses only. So the 3 doses of Rostock's 30 was given to the child. So now at present, the child had mild coryza and hoarseness of the voice. On examination, the chest was clear. Saturation was around 99%. On detailed history taking, I took all the general symptoms, mental general symptoms and physical general symptoms, and Veratrum album was coming as a remedy, which completely relieved all the core symptoms of the child, and the child was on regular follow-up for a year on single remedy Veratrum album and no fever had recurred, or the tendency of cold and cough was much less. So I never stopped after the fever paroxysm subsided. As you all know, what Hahnemann has also told, there is a psoric or a chronic disposition in every patient. So you need to treat that as well. So you should not stop after giving the acute remedy. You should follow up with a deep constitutional remedy. Then I'll discuss the second case. This was a case of a 10-year-old girl child. She was brought during pandemic time to me on 25th of August 2021. She had complaints of very high-grade fever of 101.5 degree Fahrenheit a day prior, around 9 p.m. at night. Parents had already given Procin syrup, and according to parents, the heat was generalized all over the body. So I asked about the symptoms prior to fever. So parents told me prior to fever in evening, she was having vomiting 5 to 6 times. Now also she has nausea with thirst. but drinking of water is immediately followed by vomiting. So vomiting then is followed with chills. There are a lot of abdominal pain, mainly in the epigastric region with vomiting. Nausea is worse after vomiting. So vomiting does not relieve the nausea of the child. She is afraid to vomit and starts weeping with discomfort from vomiting. So nausea is constant and there is a lot of irritations with nausea sensation. Stools are also watery and there is abdominal pains after stool. So from these symptoms is a clear-cut case of gastroenteritis with fever. Okay. So on examination, I looked at the child. She was very dehydrated. Pulse was around 110 per minute and feeble. Temperature at present was afebrile. BPM recorded was around 100/60. Urine output was good, around 4 to 5 times in a day, in 12 hours, sorry. Mouth is slightly parched down and there is no icterus, no jaundice. Abdomen is soft. There is no guarding or rigidity. Bowel sounds are increased. Increased peristalsis are heard on auscultation. Chest is clear and CNS is oriented but in distress due to nausea and abdominal symptoms, mainly the pain. So when there is a case of gastroenteritis, it's very important to ask for the urine output, mainly in the pediatric cases. If the urine output is decreasing, that means the child is getting more severely dehydrated and she might need a IV fluids. So that could be a deciding factor when to admit the child or you have to treat it on OPD basis. So from these symptoms, I analyzed the case. I took following symptoms of nausea constant, nausea not relieved by vomiting, vomiting after drinking water, nausea with irritations, nausea with thirst, chills after vomiting, epigastric pain with vomiting, diarrhea which was painful, abdomen pain after stools, watery stools, fever at night, fever accompanied with vomiting, with diarrhea and epigastric pain. So these are very few symptoms, mainly pathological symptoms. So I took BBCR repertory for analysis. So on repertorization, again I took the following symptoms: nausea continuous, nausea in stomach, vomiting after drinking liquids, vomiting aggravation after drinking, concomitants of vomiting of irritations, concomitants of stomach pain with vomiting, concomitant of thirst with vomiting, diarrhea which is painful, watery stools, abdomen pain with stools, watery stools, gastric. I took pathological type as gastric since it was a case of gastroenteritis, chills which are worse after vomiting, heat and fever in general, and night time since the fever started at 9 p.m. and concomitants of shaking with fever during fever. Again, I took the concomitant of fever as nausea and vomiting, concomitant of stomach pains with heat, fever, and concomitant of diarrhea with fever. So after taking all the symptoms, few remedies were coming up were veratrum, ipecac, pulsatilla, arsenic, and nux vomica. So how do I differentiate? So I took up materia medica, studied the materia medica of veratrum first. So I found the following symptoms to be important in veratrum for fever. So in veratrum, there is a lot of coldness in along with the fever symptoms. So there could be coldness of sweat, cold skin, collapse, vomiting and purging, and stools which are very profuse, watery, gushing, and prostrating. So in veratrum, there is a lot of coldness and copiousness. These two things you should remember in veratrum: coldness of the skin, coldness of the sweat, along with the profuse discharges, mainly the vomiting or stool, think of veratrum album. In veratrum, there could be aggravation after drinking ice cream, and before and after stools. There could be there is an amelioration from uncovering the head, sitting or lying down. Chills are with thirst and coldness. Chills running from head to toe. Face is cold. Extremity is cold. Feet is cold, as if cold water is running through them. So a lot of coldness in all the symptoms. In heat also there is coldness of the forehead, internal coldness and heat with thirst. Sweat again, which is profuse and cold, but sweat is without thirst. Craving for cold things, juicy things, cold fruits. And in apyrexia, there is a lot of exhaustion with cold sweat, mainly on the forehead. There could be cramping in the stomach, abdomen, limbs, and great thirst with vomiting. So cold stage predominates in veratrum. Again, in camphor also, there could be a lot of coldness, but in camphor, there is not much of copiousness of discharges. Remember that. That is for dry cholera. We call camphor is indicated mainly for dry cholera. But when there is a copiousness, think of veratrum. And again, if there is a lot of cramping pains along with discharges, think of cuprum as well. So trio of cholera or diarrhea or gastroenteritis is mainly veratrum, camphor, and cuprum. You see. So prescription given by me was veratrum album 200. Ask the parents to dilute with little water and give 1 teaspoon every. Since there's a lot of dehydration